Thanks everyone for joining to discuss this very important topic of stewardship of in health markets. My name is Dana Tilson. Next slide, please. My name is Dana Tilson. I'm the project director for FHM Engage, and I want to welcome all of you today. And I hope to make this session as interactive as possible. So we will have presentations from 3 panelists, and then we will open the floor to a discussion. Please introduce yourself in the chat, but if you have questions as we go along, please go ahead and put them in the Q&A, which is a button on the bottom of your screen, and then we'll be monitoring those. So we'll stop briefly between each presentation to take 1 or 2 questions, and then at the end we'll have some time for Q&A. So next slide, please. So FHM Engage is it's funded by USAID, and we're a 5-year project, and we are founded in the belief that strengthening mixed health systems, including the private sector, will lead to improved health outcomes. We use a systems approach to identify root causes of underperforming markets. We work primarily in family planning, but also in maternal and child health and other health areas. In this case, for family planning, we look critically into the reasons why private sector may not be providing adequate levels of quality family planning, contraceptives, and services. And then a fundamental aspect of this is that we apply a co-design methodology to develop locally sustainable solutions that, with the local actors in that market, to deliver long-lasting improvements in the quality and efficiency of the private sector health markets. Next slide, please. So we have a large network of strategic and implementing partners across the globe. We identify partners in each country where we work, and then we also bring in additional analytical expertise from across the globe in things like market intelligence as the needs are identified. Next slide, please. So we are currently working in 12 countries, and we are open to discussions with any partners in any countries that may want to discuss increasing their engagement with the private sector and applying the principles of market development, which we will talk about here. Next slide. So we're going to first have an introduction to market development, and then we will hear an example of application of stewardship in Pakistan, in Madagascar, and in Liberia, and then we will move to question answer. Next slide, please. So we'll hear from our 4 speakers today. Monty Achenbach is our technical director from FHM Engage, comes with over 25 years experience in market systems development. Sophie Parwan is a nurse midwife with over 25 years of experience in the health sector in Liberia. Davy Robinson is a contraceptive product specialist with over 15 years of experience in family planning markets in Madagascar. And Dr. Leila Gardezi is a medical doctor with over 30 years of clinical and program experience in family planning across the globe. Next slide, please. And we will hear opening remarks today from Abena Amwaka. She is a private sector team program analyst with Population and Reproductive Health Bureau at USAID. So I'm going to pass it over to you, Abena.
Thank you, Dana. Good morning, good afternoon, good evening, everyone. Dana, can you confirm that you can hear me okay, please?
Yes.
Thank you. My name is Abena Mwaku. I, as Dana said, I am the private sector team program analyst in the Bureau for Global Health in the Office of Population and Reproductive Health. So I sit in the USAID Washington, along with my colleagues, Kuyosh Kadarov, Clancy Broxton, Andrea Baer, and Susan Ross. We make up the USAID management team for the FHM Engage project. First, I would like to highlight, and I will put this in the chat after I'm done speaking, but FHM Engage has already developed some great briefs. One that also includes one specifically on stewardship to help orient people to the terminology and the approach. I would encourage you all to visit the Health Market Link site and explore the technical brief developed by FHM to articulate the concept of stewardship from an MDA perspective. In the most basic of terms, stewardship is what is done, what should be done, and who does it to ensure that any family planning and maternal, newborn, and child health market, or any health market, performs well. Additionally, we are interested in exploring how stewardship can help countries achieve scalable and sustainable market change to improve health outcomes. So health market stewardship is not just the realm of governments, but also ideally involves bringing together multiple market actors, both from the public and the private sector, and as such possible, as much as possible, working to align them on incentives, capacities, and accountability to address underperformance of specific market functions. So stewardship supports the market overall, so it can more effectively and efficiently improve health outcomes. So during today's webinar, we will hear for country-based examples of stewardship based on a lot of the work that FHM Engage has done and how it's being organized and utilized to affect change in the given markets. Liberia, Madagascar, and Pakistan are not only great examples of stewardship activities through FHM Engage, but are also priority family planning countries for the Office of Population and Reproductive Health. In Liberia, FHM Engage is supporting the MOH Private Sector Engagement Unit to start from the national level and then implement programs and policies at the local level to advance the private sector in improving quality of the quality of care in the private sector, enhancing financial protection, and creating an enabling environment for the private sector. In Madagascar, a multi-pronged approach to stewardship includes establishing and advancing a private public platform of exchange to strengthen coordination and partnership in the Boini region, increasing access to capital by working with the Madagascar banks to better serve the health sector, and also working through GSPS, an association of the private health sector. And finally, in Pakistan, FHM is working to reinitiate an existing stewardship platform to establish a unified voice for the private sector stakeholders to contribute towards the national family planning agenda, with the important advance of expanding it to include commercial sector actors, professional associations, and youth-led organizations. Stewardship is a means to an end, and the examples today illustrate early steps of stewardship and how it can be utilized to improve market conditions and functioning. And so with that, I will pass it back to the FHM Engage team so they can share with us these great examples. Thank you so much.
Thank you, Andrea. Next slide, please. So we're going to pass it over to Monty. Thank you.
Great. Good morning, good evening, good afternoon, wherever you are in the world. Very happy to have you here today and to tell you a bit more about what FHM is doing about stewardship. Next slide, please. First, I want to introduce you generally to the approach that we take toward market development by looking at it through the lens of this framework, a graphic we've put together that explains how markets function and how we can intervene and how others can intervene to ensure that we're addressing basic market failures that explain why private sector isn't able necessarily to address all of the issues that affect consumers in their communities. So this is an analytical approach that begins by understanding deeply how markets are functioning. What does the current market performance look like from suppliers to users and the enabling environment around it? So starting at the center of this graphic, it's really about how the core functions of supply and demand in the market are meeting the needs of consumers. So if you imagine the consumer in the center of this, is the supply adequate to meet the demand of customers in their communities? Is demand enough to entice suppliers to want to enter a given market? And if not, what's happening in this market to understand why it's failing? Around these core functions are a series of supporting functions. These are elements in the market, actors in the market who support the operation of the private sector. Below, we see rules and regulations. These are the rules of the road, the things that set up the framework for how the market actually operates. And issues in any of these sections of what we affectionately call our donut will tell us something about where we can intervene and who can intervene to make a difference to address the market failures that are keeping consumers from getting the products they need. Let me give you just a quick example of this. We've created in all of our countries a market description that explains all of these elements that you see in front of you and deepens the analysis of what's causing failures that are preventing consumers to get what they want. So, for example, in our market description in India, we found that there's very high demand or latent demand for implants as an FP method. But if you look at supply, you see very, very little supply in commercial markets that would meet that demand. Why is that so? Why is supply not keeping up with what should be an easy market? Well, by moving around the donut, you can get a sense of some of the aspects of the market that may be preventing this from happening. It could be on the realm of directly in the core function. Maybe there's not enough perceived demand for suppliers to supply the market. Why might that be? Maybe the actual supply is too expensive for consumers to afford. Why is that product too expensive to afford? It could go to rules and regulations that prevent the product from entering easily into the market. It could be taxes and duties that are increasing the price, dampening demand, and disincentivizing the supplier from entering the market. It could have something to do with the information component here. The business financing, not enough financing for, say, distributors or wholesalers to be able to offer a product like this in a way that serves their supply chain. So there are many reasons that a market could be failing and areas of potential intervention. If those were addressed and if the market failures became market benefits and there were support for increasing supply, that could be an improved health outcome that would lead to better family planning results. Next slide. So in all this, what is market stewardship? Abena said it well. I'll put it in another set of terms. I like to think of an analogy of the Lord of the Rings. It's the ring of power. It's the one ring that binds them all. It's the ultimate tool of sustainability. FHM won't exist forever. Other market development efforts have expiration dates. Markets continue to change, to evolve, to need support and facilitation over a very long period of time. These are not always quick changes. It'll take longer than 3 or 5, 7, 10 years for some of the changes to consolidate. And it takes ongoing stewardship to bring these changes to fruition over time, with the ability to adapt, to change approaches, to identify new problems as they emerge, to shift priorities. So all of these require stewardship within markets to be able to take market development efforts to the next level and to sustain them over time. So some different elements of what market stewardship is. It's about local leadership and local guidance. Beyond projects, it's local ownership to take these efforts forward. It's a vision for and a vested interest in better health market performance by local leaders, a readiness to obtain and share, most importantly, market intelligence, which is often lacking. Intelligence that would entice investors to enter a market, to expand in a market. Lastly, it's the capacity to lead market development results and to expand those results over time. Next slide, please. Stewardship can take many forms. We don't want to give the impression, as Abena was saying, that this is all about public sector stewarding market change. There are many different local actors, leaders that can take on the mission of stewardship. It can be private sector associations. It can indeed be a public sector, private sector engagement unit within the government that produces this change and leads market development, or there could be institutions within academic institutions that take this forward as well. Nonprofit organizations are very involved in stewardship, and it could be a mix of all of these. And in the examples that you're going to see today from different countries, you'll see that FHM has been very flexible and contextual in the way we approach it with different countries based on who is there to take this up and is willing to come together and move the cause of stewardship forward. Next slide, please. So overall, the steps in market development, which we would encourage any steward we work with to undertake, are simple 4 steps that are quite common to many programs. Diagnosing the issues, understanding deeply the market failures, using that understanding to design the program, move that design to the deliver and implementation stage. And while you're doing that, learn and adapt and redesign, begin again aspects of delivery that will improve constantly on the work that's being done. Next step, next slide. In the health market diagnosis phase, the very first phase, there are 4 different steps that we use and encourage others to use. Number 1, being very clear about identifying the public health problems and related markets that we're trying to address. Secondly, assessing and describing, as I mentioned earlier, the core market structure in the supply and demand of the given market that you're looking at. Next, to diagnose the root causes of market underperformance. So asking the 5 whys, going deep and understanding very clearly what is underlying these areas of market underperformance. And lastly, prioritizing potential interventions. Not all interventions can be undertaken at any one time, but prioritizing them according to the needs in the market and what will get the biggest bang for the buck along the way. Next, please. So now we'll introduce you to leaders in FHM countries that can talk about where we are with different stages of development for various stewardship models and how they're getting results in our 3 countries for which we're giving examples today. So we'll start with Pakistan and Dr. Leila Gardezi. Take it from here.
Thank you, Monty. Can I just jump in and ask Elizabeth and our host whether the question answer box is open so that we can monitor questions as we go along? If there is a pressing question that anybody has now for Monty, you can put it in the Q&A box, and we will take a pause after Leila's presentation, see if people have any questions or comments. Thank you. Go ahead, Leila.
Thank you so much. Hello, everyone. I will just take your permission to not show myself on the video just because I might be coughing in between and be a distraction, but rest assured I'll be here. Next, please. So I will be presenting a stewardship model of the private sector in Pakistan, outlining the inception of, could you go to the next one, please? Outlining the inception of the private sector stewardship platform, the impact hub in the Sindh province of Pakistan, the value added to it by the FHM project, and also share the platform's planned evolution towards the potential to sustain the private sector-led stewardship platform. Next, please. In Pakistan in 2019, Bill and Melinda Gates Foundation, UNFPA, and Population Services, a global NGO, formed a steering committee recognizing a gap in the private sector family planning stewardship. They established a private sector working group to foster cooperation and strategic guidance, drawing on global best practices. Between 2019 and 2022, the concept was introduced to the private sector market actors involved in family planning program design and implementation. Members collectively expressed expectations and identified the priority areas for effort and resource investment. A systematic consultative process refined the strategic objectives, scope, and action plans of the working group, which initially comprised of 13 core members. However, the initial membership was limited and very few members actively engaged. Next, please. The primary drivers of the stewardship platform are the private sector and the family planning as the public health area. By involving the private sector entities often excluded in discussions about improving the family planning landscape in the province, the objective of the working group is to create a collaborative platform for private sector engagement, offer thought leadership, diversity of resources and expertise, advocate for increased private sector participation in planning and decision-making, and facilitate the public sector collaboration to enhance FP implementation. As a mission, the Impact Hub aims to achieve its objectives by promoting favorable policies, fostering public-private dialogue, creating supportive operational conditions to increase the private sector's engagement in the family planning ecosystem, raising awareness and meeting the FP demand through improved accessibility and affordability of high-quality FP products and services. Next, please. So FHM partnered with the Impact Hub, an existing entity in Pakistan, for market facilitation and effective stewardship to address major challenges identified by the market description exercise, which was conducted in the year 2 of the project, and that those factors which led to an ineffective FP scenario in the province. Some of the examples are fragmentation and coordination issues hindering effective FP market stewardship in Sindh, Pakistan. Professional associations, youth voices, commercial sector were typically excluded from dialogue and decision making. Scarcity of actionable market intelligence are some of the key ones. Next, please. In Pakistan, the stewardship model centers on 3 key functions: data, dialogue, and capacity, aimed at selecting, designing, implementing, and monitoring the market interventions. Year 2 of the project focused on data collection and mobilization of the actors, while year 3 was more focused on going to be more focused on strengthening the platform, foster dialogue and links with the public sector platforms. I will share 2 examples of how important interventions can be brought to the forefront and advance the stewardship agenda. In year 2, for example, FHM Engage concentrated on establishing a private sector stewardship for quality of care by engaging stakeholders and assessing the Sindh market. This involved integrating FP quality standards into licensing checklists used by the Sindh Healthcare Commission. With support from Impact Hub, public-private dialogue was initiated to enhance stewardship, and proposing interventions included an e-licensing system, digital self-assessment, and a joint health inspection. Another example I would like to share is a market analysis in Sindh identified barriers to contraceptive services for adolescents and youth. Stewarding it from the platform led to an intervention of design to improve the FP access for adolescents and youth through a digital marketplace, which is led by the Impact Hub's youth subgroup. Next, please. So FHM Engage facilitated the reinvigoration of Impact Hub by integrating commercial sector actors, as Abena had also mentioned, professional associations, youth-led organizations, and others. Governance bylaws are being established, ensuring membership compliance. Key market actors from various sectors are mobilized to join the hub, with terms of references developed for thematic technical working groups, more visibility and collaboration with the public sector working groups of the Population Welfare Department to support FP 2030 goals through public-private dialogue, advocacy, and policy initiatives. A buy-in on governance and membership criteria was achieved through a consultative event which was held in January of 2024. On the right side, you can see a structured management system A well-structured management system empowers a stewardship platform to lead effectively, communicate efficiently, and make informed decisions, contributing to its success and growth. This includes leadership, secretariat, committees, task forces, etc., for strategic planning and decisions. Guidelines for meetings, confidentiality and engagement, and a focus on performance evaluation. The priorities will, however, remain stakeholder engagement, sustainability, and income generation. This is work in progress. Next, please. Impact Hub, in partnership with FHM, has thrived, achieving significant milestones by engaging a commercially oriented private sector in socially beneficial healthcare initiatives. Notable achievements include its formal launch by USAID's Healthy Market Community of Practice event in 2023, where information exchange around market development and private sector engagement led the forum, and a diverse group of private sector members committed ongoing support for family planning in Pakistan, availing the platform for a Bill and Melinda Gates-led DMPSC roundtable was also conducted as a technical initiative. Next, please. Once the Impact Hub expands its member base and registers as the appropriate local entity, it will maintain a consistent focus on sustainable growth. Productive engagements, open communication, and robust governance structures are vital for fostering trust, integrity, and effectiveness within the platform, facilitating the achievement of its mission and objectives. Externally, it will establish dialogue forums, engage stakeholders, and advocate through communication initiatives. Lastly, the platform aims for self-sustainability through income from its member services and external funding, supported by mechanisms of accountability, transparency, efficiencies, and risk management. Local capacity building and skills transfer bolster market engagement with operational support and advocacy initiatives covering the administrative costs. Sustainable outcomes are guaranteed by the ongoing involvement of excited and involved local market actors. I will stop here. Thank you so much for your attention.
Thank you very much, Leila. That was very interesting, and we look forward to hearing comments and questions about this. There is a comment that's in the Q&A, so I encourage everybody to have a look at that. And if the person that wrote that would like to say anything in particular about that now for a minute, we can pause here before the next question or before the next presentation.
This is actually an experience sharing, as I read it, Dana.
No, I don't think it's necessary to read it unless there's a comment on it, Leila. We might come back to it in the discussion session at the end.
Sure.
Okay, great. Let's move on then to the next presentation. Next slide, please.
Thank you. Thank you, Dana. I'm David Robson, product specialist for FHM Engage in Madagascar. Thank you for all participants to joining this webinar. As you can see on these slides, we have Madagascar's stewardship model to improve health market functions. Next slide, please. We have two models of stewardship and two examples of successful stewardship in Madagascar. The first model is the private and public platform of exchange, and the second model is the leadership of a private sector group. And the two examples of successful stewardship is the bank support to private health sectors, and also the inclusion and leadership of the Faculty of Medicine on developing curricula of training. Next slide, please. The model one is about the public and private platform leads health performance at regional levels. This platform was launched in April 2023 by FHM in Bweni region. The platform objective was the strengthened coordination and partnership between the public and private health sectors. And the second objective is to maintain a permanent dialogue between public and private sectors members in the region. What is the advantage to the market function? We have the Ministry of Health playing its roles as a steward and supporting function to the private sector. This platform is led by the Directorate of Regional Public Health in this region. We have also improvement of the health access information for private sector and all market actors, and also facilitation for private sector accreditations. And finally, we have improved market environment through product supply information availability. Next step on these platforms, models and challenges, institutionalization of the platform. And also the role of FHM is to facilitate, to train, to coach, and all aspects of logistic of this private and public platform exchange. Next slide, please. The second model is the leadership of the health private sector group. It's like a Pakistan model also, but I know the Pakistan models come from Madagascar models. What is the main results of this health private sector group? Strengthening its organizational and institutional capacities, advocacy to different private sector key players to adopt the same visions, proven leadership in the integration of the private sector into many health policy process and into the health information system, proven leadership in the organization of a private health sector exhibition in Madagascar. The second round of exhibition is planned to be implemented in this June of this year, and also exclusive partnership in the fight against HIV. What is the advantage to the market function? Voice of all private market actors with MOH and partners. Improvement of private sector database. Supply chain facilitation for family planning product availability. That is the case, actually, with wholesalers, pharmaceutical representative in Madagascar. Networking facilitation among members. Advocacy for legal and tax policy of health private activities. I think it's an innovation with all private actors, and also partnership facilitations and norm and standard facilitation. This platform is formed on June 15, 2021, and recognized by the Ministry of Public Health as a true strategic interlocutor of private health sector in the development, implementation, and monitoring of all sectoral policies and regulation affecting the health field. Next slide, please. Now we have an example of successful of stewardship. We have Société Générale, the first bank based in Madagascar, committed to support health entrepreneurship by making available space to health actors to improve entrepreneurship and business management capacity, offering financial services package with adapted conditions, offering financial services loan with advantageous rate, and dedicated team to accompany the private facilities in becoming good enterprise. Why this is stewardship successful? But the Société Générale knows that they support private sector without deposit contribution assistance. This model ensures sustainability for this approach. What is the advantage to the market functions? Increase private actor access to finance, improved private actor business capacities, access to health equipment, infrastructure, and products, supply quality of medical materials and health products, and increased demand from health private actors. Next slide, please. The second example of stewardship successful is the involvement of Faculty of Medicine on the change of basic training. Why? We have a kind of problematic concerning training, health training in Madagascar, low quality of care, insufficient market intelligence, market actors only serve urban area, while 80% of population are based in rural area. Student orientation is public, lack of management and of management capacity. How? Faculty of Medicine committed to integrate new modules into the training curriculum. We have 5 topics on that. And this initiative comes from shop stools and strengthened by FHM Engage. What is the advantage to the market function? Improved skill of whole health market actors, and also barriers to quality of care will decrease. Next slide, and thank you all for your attention.
Thank you, Davey, very much for that insightful presentation. And we look forward to talking a little bit more about some of these particular activities during the discussion session at the end. So please, for any audience members, I believe the Q&A box is open now to put questions or discussion points. If you're having trouble with that, just enter them into the chat. So I think we will now move on to the next presentation from our colleague, Sophie. Over to you, Sophie.
Good afternoon, good morning, wherever you are in the world. Welcome to Liberia. Liberia has a very small population, 5 million, but our teen pregnancy rate is high. Access to FP, so FP stewardship is so important, and that's why we are going to discuss today strengthening stewardship with local market actors, what FHM has done so far in Liberia. Next slide. And we'll also look at the history of Liberia. Like I said earlier, it's a small population growing rapidly, but the history for private sector started around 2021 with Palladium USAID support, assessing the private sector, and the first ever private sector engagement strategy was developed. Next slide. And that strategy focused on strengthening the private sector value chain for contraceptives, including reducing the cost of branded FP products, government donor-supported FP products are very high in the market, and thus creating the disadvantage for private actors to access or benefit from the market. Next slide. So what market collaboration problems are we trying to solve here in Liberia through FHM and the Ministry of Health and other key actors? Approximately 40% of all health facilities are private, and about 3 in 4 private facilities are actually located in Monrovia, in Montserrado. Out of the 15 counties, almost all of the private facilities are located here in Montserrado. The private sector is actually fragmented, but growing rapidly, and there is an understanding collective contribution, especially from the pharmacies, in expanding their products and services to other areas. Insufficient capital and lack of resources and incentive to provide quality FP services and products, and especially market information, market intelligence. These are all lacking. Next slide. So the FHM and Ministry of Health, Liberia, FP stewardship strengthening achievements. So far, we've conducted a comprehensive FP market description study, which shows that the need for family planning is high amongst married women, and it's also high amongst women in the most populated counties. 4 of the most populated counties do need family planning. So we've also designed an integrated FP immunization activity targeting women in urban areas. And I saw in the box someone from Pakistan sharing the experience. So this activity is actually targeting urban areas as well as creating access for slums, ghettos, mining areas, peri-urban areas, in central prisons and difficult areas with children. This design has helped us to integrate family planning and immunization, creating a robust referral program which has served over 2,000 plus family planning recipients in 2 quarters. We are also supporting the Healthcare Federation of Liberia to coordinate the private sector, stakeholders, and advocate for their welfare, and collaborate with the ministry to improve the quality of care. As in the private sector, our health sector is mainly donor-driven, and so all the resources are skewed towards the public sector. But the Healthcare Federation has over 50 to 60 members now. We are also supporting the Ministry of Health private sector unit to improve collaboration with the private health sector and all other actors. We've launched the Liberia Marketplace activity to provide catalytic funding to advance innovative solutions to improve healthcare outcomes, mainly through microfinance institutions to provide an assisted or reduced very minimal rate so that FP and other maternal and child health services could be offered in the private sector. Next slide. What are our approaches? Which model are we using? We are strengthening the private health sector associations, mainly through the Healthcare Federation of Liberia. And we're collaborating with the public institutions, the Ministry of Health, private sector unit, the county health teams, the district health teams. And these district health teams have a decentralized system where they are having technical working groups. And for the first time, Liberia is now integrating technical working groups at a decentralized level where the private sector is now being represented. They have a voice now in discussing health issues. Also engaging with the non-bank financial institutions. Banking institutions have a very high rate So we are engaging with non-bank financial institutions to expand access to flexible capital for early startups and existing businesses. Next slide. So what learnings do we have from our stewardship collaboration? Stewardship promotes transparency in corporate governance policies. So currently, we are able to identify where government subsidy is going to the private sector and where government subsidy is not going. We've been able to share the government criteria that will enhance the participation of the private sector, a decentralized structure that can facilitate stewardship in a resource-limited area. So most of our early startups are now will be benefiting from this type of stewardship opportunities that FHM is offering. Stewardship values from our lesson learned can apply to long-term benefits for business growth. This is the first time for businesses to receive or even negotiate with non-banking institutions to access capital for their businesses. And the stewardship opportunities are show defined roles, responsibilities, and provision of resources for the actors, the private, the faith-based organizations, the early startups. All of these can help to foster collaboration for the private sector and as well for the public sector and provide the overall health outcome for any country. Thank you.
Great. Thank you very much, Sophie, for those insights in stewardship and how it can be used in Liberia to have improved health outcomes. Thank you to all of our panelists. I would invite all of our panelists to come back on video, and we have a few minutes for a discussion. And I think, a big thank you for putting this together from our country specialists, Layla from Pakistan, Davy from Madagascar, and Sophie from Liberia. I think we've heard how a focus on stewarding the market, private and public markets in these countries can result in things like improved quality of private sector services for family planning in Pakistan, how it can result in an increase in access to financing by matching banks with healthcare providers in Liberia, and increasing contraceptive availability in private sector markets in Madagascar by linking manufacturers to import additional products with importers and distributors within Madagascar, and hosting activities like trade fairs to bring all of those sector partners together. So I'd like to open it up now, and if you're having trouble adding questions to the Q&A, feel free to put them in the chat or to raise your hands. Let me open the floor.
And Dana, just flagging that I think the previous question, I'm not sure if it was answered. So Layla, I don't know if you want to ask that first question that was in the Q&A.
So I'm not seeing the question now. Layla, can you see the question in the Q&A? Can everybody else see it?
So it's more of a sharing of experience of how vaccination services were sort of improved by activating the private sector. And this is from Pakistan. I'm not sure if there's the question here, unless I'm missing something. This actually acknowledging how involvement of the private sector providers, it actually led to a successful intervention of improving the immunization in children.
So I'd like to invite any of our colleagues who have any questions for panelists or comments. I think it would be interesting to have the thoughts from others that are on this call about what stewardship has meant and how we can do it better. And if our colleagues from USAID have any comments on broader USAID stewardship efforts, that would also be welcome. Otherwise, I have a couple of questions that I can ask each of our panelists. I'm not sure if I'm seeing people's hands, so maybe just speak up. So Lucy, do you want to share in Zambia what's happening? I think there was a comment from Lucy that in Zambia, they're supporting market development with the Healthcare Federation of Zambia, working on quality improvement in the private facilities with safe care and a business advisory program. I had a follow-up question, Layla. Perhaps you can explain a little bit more about how the Impact Hub has facilitated the SIND government and the private sector to address quality initiatives for improving quality and regulation of the private sector family planning. Who were the key stakeholders in that partnership, and how has that evolved?
Yeah, thank you for the question, Dana. So as explained by other panelists also, and is also by Monty, and there was a process which was followed. So in the previous year, most of the efforts and resources was on collecting the market, developing the market description, identifying what are the key barriers or constraints which are leading to an ineffective FP landscape, and identifying the root causes for lack of access to family planning services by the population. One of the key things which was identified was that there is sort of a lack of quality of care in the private sector, and there's really no structured mechanism of assuring quality of care in the private sector. And so this was sort of raised as something which needs to be addressed. And the stewardship platform, that's FHM and Impact Hub together, took it upon themselves because this required a larger umbrella cover by the public sector. There was engagement with the public sector in Sindh, and this was driven by the Sindh Healthcare Commission. And the Sindh Healthcare Commission sort of was brought on board. There were consultative dialogues between the public and the private sector. And then we sort of took upon a couple of global best practices, and these were sort of shared with the public sector, because eventually it will be the public sector who are responsible for the rules and regulations and making sure that the private sector quality comes under the ambit of the quality assurance mechanism of the public sector. The Population Welfare Department has a costed implementation plan cell of which is moving towards FP 2030, and one of the key agenda of that is also quality of care. So keeping all these informations together, it was some of the key elements which came out was that there needs to be a minimum FP standards incorporated in the quality assurance checklist of the Sindh Healthcare Commission. This was developed by FHM in the previous year. It's incorporated in one of the briefs which was developed on the quality assurance landscape in Sindh. It was presented to the public sector. And through this process of the collective wisdom of the private sector and the public sector together, there was sort of an advancement in having an licensing mechanism, which is still work in progress, but it was initiated by the project.
Great. Thanks, Leila. Sorry to cut you short. We have about 1 minute left, and there was another question around financing and what have been the challenges for getting financing to the health sector. Sophie, I think you've been working on that in Madagascar and FHM, not in Madagascar, in Liberia. Davey's been working on it in Madagascar, and FHM has been working in other countries, including India and Kenya. And that's complex, and maybe Sophie, you can say 1 or 2 things about the challenges that you've had and where we stand, and then we'll have to close it for today. But if people have answers or comments on the questions that are now in the chat, please go ahead. Sophie maybe has the last word.
Yes, so the private health sector is not accessing financing. Our health sector here is donor driven, and the banks, the rates for credit, the rates are very high. So our approach is to reduce the risk, de-risk all of the banking rates, so that existing businesses can have access to financing to scale up their businesses.
Great. I think we're over time now, so we will close now, but we're going to take a note of these questions. And if any of you on this webinar would like more information about what FHM Engage is doing in stewardship and any of these areas that were spoken about specifically, please do contact us. You can contact me, Detailson at fhmengage.org, or send an email to our USAID colleagues. So thank you very much for coming today, and we will close it at that. I think you'll see in the final slide here, upcoming webinar topics will be on market development approach, which was done in April, will be done in April. There'll be more on access to financing in May. In July will be the development of marketplace solutions using the market development approach. And September, there'll be more on youth FP markets and DMPA analysis, and some interesting findings around what is going to be the evolution and coming next for the private sector beyond social marketing. So thank you very much for attending, everybody. I hope you have a wonderful day.